My name is Heun. I'm a consultant psychiatrist, and I'm from Global Psychiatry Archives. And today we have the pleasure to hear a talk from Vipul Janardan from New Delhi about the role of stem cells in psychiatry.
Hello, everybody. I'm Dr. Vipul Janardan. I'm from Institute of Human Behavioral Life Sciences, New Delhi. Thank you for having me here, Dr. Reiner. So we will be talking about this stem cell therapy in psychiatry. This is a very new topic, and day by day it is gaining in momentum. And as it is like in other sciences like neurosciences, it is already gained momentum, but in psychiatry it is totally infantile at the infantile stage. So let's begin.
Okay, so just to make it simple, I ask you a few questions, and yeah, you explain your answers to the listeners. I hope they will learn an awful lot. So the question is first, what are stem cells and how might they be relevant in psychiatry?
So stem cells are unique cells capable of renewal and differentiation into specialized cells. In psychiatry, the interest lies in the potential to regenerate or repair damaged neural circuits, particularly treatment resistance like schizophrenia, major depression, neurodegenerative syndromes, psychiatric syndromes.
Okay, so what does current research tell us about the use of stem cell in psychiatry? So what are the current research assessing?
Certainly, most studies are still in the preclinical or early human trial stages. Animal models have shown promising result. For example, mesenchymal cells still appear to reduce neuroinflammations and modulate neurotransmitter pathways. In depression model, they have shown antidepressant-like effect. However, human trials are in infancy and ethical concerns remain high.
Right, okay. So what are the main ethical or practical challenges associated with stem cell therapy in psychiatry?
You have touched like a very good question, question. Uh, the brain complexity make target delivery a challenge. They are concerned around identity, consent, long-term effect, and unintended consequences like tumor formation. Moreover, psychiatric symptoms are rarely due to single cell in failure. It is often like circle level dysfunction.
Right. So, in your opinion, how might stem cell therapy fit into the future of psychiatry? So, you mentioned some of that. So, what's the future going to be?
I envision a future with the stem cell therapy. It may support neuroplasticity, maybe cognitive function, and even progression in severe disorder. Perhaps as adjunct to the pharmacotherapy and psychotherapeutic treatments, but we need cautious optimization and robust evidence and longitudinal data to support or to inculcate in our psychiatry practices.
So can I ask you, is Alzheimer's disease something which might be relevant? Or
What?
Parkinson's disease? Alzheimer's disease or Parkinson's disease, would they play a role?
Yeah, still, actually, this is still researches are going on, but still we cannot like at the still is things are in the infantile stage, but still we need to do lot of researches and then we can come and tell it to like our and it will be helpful to the our patient uh, when the full things comes up.
Right, okay. So how important is it if you have that we have an international collaboration in advancing stem cell research in psychiatry? So what's the role of research collaboration, especially
I
from
think
India or globally?
I think stem cell research need global regulations and cooperation. India have a great scientific talent, but we need uh, we need we need a lot of people where researchers are doing for stem cells. Then we can come and make some make some good plan, and then we can come to a conclusion and can be beneficial to the humankind for our patient. And then so we need a collaborative effort instead of one country or others. So we need a global effort in this stem cell therapy, like any other science we need.
Can I ask you, so how many years are we ahead from things happening? So what would you say? Are we talking 10 years, 100 years, or how many years would you guess that the first
Yeah,
stem
I
cell
think
therapy might be
probably
available?
I think since a lot of sciences come, like a lot of advances is coming in fact, artificial intelligence is coming. So I think probably I think 5 or 10 years, the stem cell future will be there, and we will have more we are seeing more potentials in stem cell therapy, and in other stem cell therapy can be was used in multiple sclerosis and other diseases. So I don't think so. The future is like way long back, way long ahead. Sorry. So it will be in the very few years, or in fact, probably in the month. I'm very optimistic about this. So probably I will see the future of stem cell therapy in psychiatry as well.
Okay, you have to promise to keep us up to date then, okay?
Uh,
Okay,
thank you so much.
thanks so much, and thanks for these comments. And